The patient is a 3-month-old female with trisomy 21, bronchiomalacia, and vascular ring status post-repair. We are currently hospital day 79, and the patient currently resides in the CVICU. The patient's weight is 6 kilograms, and no known drug allergies are known for this patient, nor any allergies overall. The patient's history includes immunizations are up to date, surgeries. He had his vascular ring repair done in December 2019. Family history includes the mother has type 2 diabetes. Social history includes that the child lives with his mother and father at home and a 2-year-old brother. No pets in the house. Significant events overnight, emesis ×1, and feeds were paused. Patient had brief episode of desaturations after emesis, and he self-recovered. He required PRNs for irritability and fussiness ×2. Medications are included within the physical exam. The physical exam includes the following. From a respiratory standpoint, the patient is on NIPPV RAM settings of a PEEP of 10, rate of 30, pressure support of 10, and FiO2 of 30. Respiratory rate ranges from 29 to 58, with saturations between 93 and 99. VBG this morning revealed that the patient is in compensated respiratory acidosis with a lactic level of 0.8. The chest x-ray this morning revealed an improvement in the right upper lobe, though it was only slight. A decreased amount of pulmonary edema compared to yesterday's chest x-ray, but again it is very slight improvement. The patient is currently on easy PEP regimen Q4 hours. From a cardiac standpoint, the patient does not have a murmur. The heart range is 107 to 127. Blood pressure of 70 to 86 over 33 to 66 with a MAP of 48 to 71. And CVP ranges between 6 and 15. Renal NIRS are 52 to 89 and cerebral NIRS are 69 to 79. From an FENGI standpoint, the patient has a net balance of positive for 229 for the past 24 hours. The patient's urine output is 2 kilograms per hour, and the patient is on Lasix BID, Colace, zinc, and pear juice Q-Day. The patient is on a diet of breast milk Gerber with a rate of 25. From a heme ID standpoint, the patient was afebrile overnight, and the BNP and CBC showed nothing remarkable, everything within normal range. From a neuro standpoint, patient has been irritable. His Precedex drip was turned off last night, and the patient is on a scheduled dose of Ativan and Clonidine. Methadone dose is on a scheduled wean per pharmacy every 6 hours. The patient has PRNs available if needed, such as Ativan, morphine, and oxycodone. Again, this patient is a 3-month-old male with trisomy 21, bronchiomalacia, and vascular ring status post-repair. Patient has mild improvement in his chest x-ray this morning, still concerning for pulmonary edema. He did not tolerate his 25 ml per hour of ND feeds last night due to emesis, and we will try again later today. The problem list of this patient includes health maintenance, bronchiomalacia, trisomy 21, vascular ring, unrepaired, now repaired, compensated respiratory acidosis, hypoxemia, irritability, malnutrition, and fluid retention. Differential diagnosis include respiratory failure, pulmonary edema, fluid overload, pneumonia, bronchiomalacia, and potential withdrawal. The plan for this patient, the patient is a 3-month-old male with trisomy 21, bronchiomalacia, and vascular ring status post-repair. The plan is, from a respiratory standpoint, we are going to wean the rate on the RAM settings to 26, continue easy PAP Q4 hours, and continue to monitor the respiratory rate, oxygen saturations, and get another VBG and chest x-ray tomorrow morning. From a cardiac standpoint, we are going to increase PO Lasix to Q8 hours to assist the pulmonary edema revealed on the chest x-ray this morning. From an FENGI standpoint, we are going to continue ND feeds at 25 mL per hour today, as tolerated by the patient. Stop if emesis occurs again. Continue replacement of vitamin D, vitamin C, and zinc. Continue Colace and pear juice for the constipation prevention. Patient has a net fluid balance goal of -200 to 0 for the next 24 hours. From a heme ID standpoint, we will monitor for fever and culture if necessary. From a neuro standpoint, we will continue the scheduled medications. PRNs such as Ativans, morphine, and oxycodone are available if needed. We're going to monitor the patient for increased agitation. We'll watch his blood pressure, heart rate, and clinical status closely for withdrawal. And that is the plan for the patient today. In the meantime, I'm going to consult pulmonary to see if there's anything that we can do due to this chronic picture of pulmonary edema within the lungs and not being able to clear up that chest x-ray. My consult goes as this. My name is Ellie and I'm an NP student within the CVICU. I have a patient who is a 3-month-old male with trisomy 21, bronchiomalacia, and vascular ring status post-repair. Patient is on NIPPV, RAM settings of PEEP 10, rate of 26, pressure support of 10, and FiO2 of 30. The respiratory rate ranges from 29 to 58 with saturations between 93 and 99%. The VBG this morning revealed that the patient is in compensated respiratory acidosis with a lactic level of 0.8. The chest x-ray this morning reveals a slight improvement in the right upper lobe and a decreased amount of pulmonary edema compared to yesterday's chest x-ray, but again, that is only slight. The patient is currently on EasyPAP regimen Q4. Our team would love a second opinion to ensure that we are doing the appropriate respiratory regimen for this patient. There was a slight improvement in the chest x-ray this morning, but this has been a chronic issue for the patient, and any recommendations would be appreciated. If you don't mind coming to take a look at him, we would greatly appreciate that. And that is the presentation for this patient.